The news broke yesterday. Former President Joe Biden diagnosed with prostate cancer. Biden's office confirmed it is an aggressive form of the cancer. So today, Dr. Theodore Manny, a urologist in the Triad and member of the Cone Health medical and dental staff, is helping us understand the danger, the diagnosis, and the treatment for prostate cancer as well. All right, so let's just kind of start with the basics. What is prostate cancer? How does it develop?
Absolutely. Thank you for having me. The prostate in a man is a gland that's involved in reproduction and that unfortunately has a very high propensity to form cancers, kind of like how breast cancer form in a woman. Similarly, in a man, prostate cancer is pretty darn common.
Okay, how common is it compared to like other cancers? Maybe to give us some context.
Absolutely. So behind skin cancer, it is the most common malignancy in men, absolutely. And about 1 in 7 men will be affected by prostate cancer.
Okay, so let's talk about some risk factors, whether that be age or lifestyle or ethnicity.
Absolutely. So you nailed a lot of them right there. First is age. Prostate cancer is generally a disease of older men. It's pretty uncommon to be diagnosed before age 50, and the risk goes up thereafter. In terms of risk factors beyond age, ethnicity is also a large one. Folks who have African descent are at a higher risk of prostate cancer and a higher risk of aggressive prostate cancer. Family history plays into it some too. Those of us who have a father or a brother who's had prostate cancer, that does increase our risk some too.
All right, so with that said, what are the guidelines for when you should be starting to get screened for prostate cancer?
Absolutely. For most men who don't have a family history, at about age 50 is when we generally start screening, and that's with a blood check and exam both. Blood check and exam, because neither are really perfect. For men who do have a stronger family history, we generally start at age 45.
Okay, and so 40, 45 or 50 and PSA testing and other types of test screenings as well. So if your doctor's not only doing one, you need to ask for something else?
That's exactly right. And, although we don't have all the facts, it appears that for Biden, for instance, it was not the blood work that caught him, it was the exam that did. So you're correct. Both are important, the blood check and exam both.
Okay. Maybe there are some men who probably haven't gone to the doctor. Their wives are like giving them the evil eye at the moment, like you need to go get checked. Let's talk about maybe some common symptoms of prostate cancer so that we'll all kind of be in the know of what we should be looking for.
Sure. The most common symptoms are going to be changes in urinary function. Urgency, frequency, or maybe seeing blood in the urine. Those can be early signs of prostate cancer. But confusingly, they can also be signs of non-cancerous prostate problems, but that still need attention. Like changes in urinary pattern, blood in the urine, those are the biggest symptoms to watch for. Or also new bone pain. Prostate cancer, if it spreads, it likes to go to bones. And unexplained bone pain as we age, that can sometimes be a sign.
Okay, and when you said like the patterns of like when they go to the bathroom, so often we kind of pass that kind of stuff off like, oh, I've been drinking a lot of water lately, or I always get up in the middle of the night. I guess I should stop drinking after 10 o'clock. How much of a change are we talking about?
It's a great question because those things do change some as we normally age. For a man in their 50s to 60s, once to twice a night is actually pretty common. But if it's 5 times a night, that's a problem.
Okay, gotcha. All right, let's talk about the stages of prostate cancer. So we were talking about how the former president was diagnosed with a later stage. Kind of walk us through the different stages.
Absolutely. So fortunately, most men are caught much earlier than the former president. Most men are caught in stage 1 or stage 2, which basically means that it's still isolated to the prostate alone, and the chances of cure are very high. So stage 1 and 2, isolated to the prostate alone. Stage 3 is where things start to get more risky. That's when it has spread a small amount outside the prostate, but it's still pretty close. It's still pretty close to the area where it started. But stage 4 is where things get very, very risky. That's where the cancer is spread other places, usually to lymph nodes or to bone, and that's when we consider it metastatic. And unfortunately, at that stage, it's usually not curable, but there still are some great treatment options that can still increase a man's longevity significantly.
I know a lot of the talk was that he is out of the age range for when people are usually screened for prostate cancer. I know you said it started at around 45 or 50. Is there an end time of usually when men no longer get screened for that?
Absolutely. And this is where things get kind of fuzzy, especially for the former president, is because You're correct. At his age of 82, he was outside most screening guidelines. For most men who are, again, of average risk, we stop the blood check and exams at around age 70. For men at a higher risk at age 75. But the former president at age 82, he was outside all screening guidelines. You're correct.
And why is that? People would wonder why. It's the same thing for colonoscopies and stuff too. Once you get to a certain age, you no longer do that. Why is that?
Again, it's kind of counterintuitive, and a lot of it has to do with the fact that since prostate's more common as we age, there's lots of false positives. There's lots of cancers that are picked up that probably would never cause a problem. And we certainly, as a profession, don't want to over-doctor people and over-treat people. And so on average, we wind up, we think, maybe causing more harm than good after a certain age. And so that's why we generally do stop, is because there's so many more false positives as we get to be in the older stages of life. But unfortunately, there are cases, rare cases, where it can still be problematic.
Okay. All right, we're going to take a quick break. We're going to be coming back with the doctor. We're going to be talking about what kind of lifestyle things can you be doing now before you reach 50 and after 50 to keep yourself in good health from this. We'll be right back.